Hello, and welcome to HeartSense's The Pulse, where we tackle pressing issues in healthcare. Today, we will discuss the significance of interacting with your government officials to have a greater impact on your own community's health and well-being. I am joined today by our special guests, our co-founder, Dr. Antoine Keller, and Senator Gerald Boudreaux. Senator Boudreaux and Dr. Keller, welcome, and thank you so much for joining me today.
Thank you, Sabrina.
Glad to be with you all, and thank you all for bringing a little government to the community.
Yes, thank you.
As I might have mentioned before to Sabrina, Senator Boudreaux, we appreciate your presence in the community and you bringing the government to the community yourself, because I told Sabrina the other day that there is not an event that I go to related to healthcare in the community that I don't see your face. That's one face that I see every single time. And we appreciate that more than you will ever know. And so quite naturally, when we were thinking about doing a pulse segment on relationships with elected officials and why it's important and how to go about contacting your officials and what to do to be able to get things done in the community, quite naturally, you were the first one to come to mind. So I really appreciate you spending a little time and sitting down and having a chat with us.
Well, it's my pleasure. It's an honor, first of all, to assist you and your team throughout this state as we continue to improve health outcomes. And, as we go through this, one of the, themes that I like to talk about is connectivity. So you and I are connected, we connect our community, and hopefully we'll be able to give the people that get a chance to view this an opportunity to understand how can we work together to do more.
Absolutely.
Yes, that is wonderful. Then thank you so much for being part of our Pulse recording today and being able to speak about some different topics to our community. So let's get started with the questions. All right. So how long, Senator Boudreaux, have you been part of the District 24 community?
So I got elected in 2015 to serve the citizens of Senate District 24, which encompasses portions of 3 parishes: Lafayette Parish, St. Martin Parish, and St. Landry Parish. But prior to that, I spent a little over 40 years in local government, heading up the Parks and Recreation Department. So one of the things that was, very at the top of my list is just reaching out to the people in all 3 of the parishes and see how we can come together and do that. So, altogether over 40 years. And of course, I grew up in North Lafayette. So we've been here our entire life. And just a great opportunity to serve in a leadership position in the Louisiana State Senate.
And so, Senator Boudreaux, you've been involved in government for a long time. And from what I heard you say in a previous conversation, you were in government even when you had a day job. Can you talk a little bit about the evolution of your presence in government, how you got to be a senator now, which is the pinnacle of your political career, but there were a lot of steps along the way. Can you describe that to us?
Yeah, absolutely. Local government gives you an opportunity to deal, day to day with people, interacting with them at church, at Walmart, throughout the community, and the whole 9 yards. And as the director of Parks and Recreation, where, we had over 35 parks and 10 recreation centers, several golf courses, and all those other amenities, it gave us an opportunity to interact with these people on a regular basis at the local level. And so we deal at the local level with the city council. So we had input with the city council to work with state legislators as well as federal officials, our United States congressmen and senators, to try to improve and bring that quality of life to the people in our community. So over the years, as a Parks and Rec director appointed by the mayor, we got a chance to do that. And an opening came up at one point in the Senate district that I reside in. And we thought it would be a great opportunity for us to take advantage of that, because there are 39 senators in the state of Louisiana and 105 members of the House of Representatives. and the turnover is usually not that high. So the best time to get in is when someone is getting out. So I was fortunate enough to be close enough when that opportunity presented itself, and we were successful, and here we are today.
That's amazing. And, there are three things that strike me about that. One, at HeartSense, we are all about going out into the community and meeting people where they are and actually touching people. And what I heard you say is that you were very active in being present in the community all the time, touching people, making sure that they have what they need, and establishing a network or a hierarchy of administrative people that can facilitate your role as a state senator, local government and community government and community activists. And all of those people don't do things in a vacuum. They're all related to you in one way or another. And it's very important for people to realize that at all of these steps along the way, you have people that you can interact with that can communicate with Senator Boudreaux what you want to have done in Baton Rouge. You don't have to go to Baton Rouge. You can stay right there in your community.
That is correct. And look, our 40 plus years in Parks and Rec, we got an opportunity to see young people who came through our programs. We got an opportunity to work with seniors who looking for some recreation opportunities, some freelance deals, and included in there, I officiated college basketball for 28 years and was fortunate enough to work the Final Four on 5 different occasions. So, and then after
you still have some handles, Senator Boudreaux. You still got some handles. You can.
No. We watch it from a distance, Doc.
Okay.
We watch it from a distance. And then after the 28 years, we spent 7 years as the supervisor of officials in the Southeastern Conference, one of the premier conferences in the country. So, as you said earlier, just like HeartSense and getting a pulse for what's needed, we've been there, and I think that's one of the traits that assisted me in getting elected. So, you take that period of time that we were out there, and like you said, where people saw us. I've been fortunate enough to be asked to serve on boards and commissions, and find out what is it these groups need within the community. So again, this is a perfect our partnership here really speaks volumes as to what we're doing, and I thank the Lord for the blessings and opportunities that have been presented to me, so that we can lead these people. And as we've said previously, they elect a person to go to Baton Rouge to be their voice. And unfortunately, the district that I represent is one that's underserved. The education levels are low. When we talk about poverty, when we talk about unemployment, they're high. And so it's incumbent upon the individual to accept those challenges and work together with everyone to improve their quality of life.
Yeah, and I think that it's important for us not to underestimate the power of local community activists, people like Tracy Ante, who's at the Opelousas General Foundation, and the Council on Aging, and Dr. Brooks, and all these people who are in the community on the ground doing all the work, that have direct communication with you. And you enable them to be who they are and to be able to do the things that they like to do by virtue of the fact that you have people in the community who tell you how great a job they're doing. And you can devote resources on all the committees that you're attached to. And we're going to get to that in a minute. Okay. In the Senate, to be able to allow them to be able to do the things that they love to do for the people where they are in their community.
Absolutely.
Yes, that's a great segue for us to talk about the next topic. So, Senator Boudreaux, you are on a number of committees to make a difference in your communities and in your district. But I'm curious, for the Health and Welfare Committee, so that's about 10 members of representatives that are on this committee, and you have so many different topics that you have to go through: alcoholic rehabilitation, childcare facilities, and then you have health and welfare in general. Yes, exactly. Mental health, nursing homes, so many other elements that go into what you have to discuss within this committee. So my question for you is, how do the state senators on this committee identify what to really prioritize as concerns in order to represent their own communities in their specific districts?
Yes, the Health and Welfare Committee, sometimes referred to health and warfare, because there's just so many battles, there's so many items that come up, and a lot of them are driven by what's happening in our communities, and what's the need there. And we'll dive into the health and welfare, but let me just give just a little. I also serve on finance, so a lot of the ideas that we come up with when you talk about health and welfare, there's a dollar attached to those. So the Senate Finance Committee is the last stop before a bill gets to the governor's desk for funding of those. So finance is a very powerful committee. I'm fortunate to have a seat on there. I also serve on the executive committee of the Senate. I serve on local and municipal affairs, which is another hot committee because you get a lot of controversial issues that start off at the local level that sometimes get punted up to the state level because the locals prefer not to touch it. They would prefer somebody else to get the credit or the blame. And then, one that's near and dear to my heart is I chair the select committee on military and family assistance for our veterans. We spoke about mental illness and we talk about health when we talk about health and welfare. And, because of PTSD and because of so many other issues that our veterans deal with, we see a lot of that at the Health and Welfare Committee. You named a few earlier as to some of the items that we're on. We can also put on that list, the 2.5 years of COVID when we had vaccinations. I mean, there wasn't a blue book or a blueprint to decide how we do this, how we roll out, what businesses stay open, which ones close, what's the capacity levels. All of that comes through the Louisiana Department of Health and Hospitals, which works very, very closely with our Health and Welfare Committee on passing rules and regulations to decide how we react after a disaster, how we prepare for it in advance. And that's when the nursing home issues come up. And as you all are aware of, we've had some issues with nursing homes where we didn't cross all of the T's and dot all the I's, and we lost some people. And because of that, now laws have been changed. So the priorities actually, come from within, and that's internal and external. Some of those are driven by agency, some are driven by law enforcement, some are driven by the industry. So when we talk about the industry, we're talking about accreditation, we're talking about certification, boards, the various boards for all of our respective disciplines. When we talk about healthcare, a lot of those have to come to health and welfare for oversight to ensure that what's in the statute is actually being followed. So it entails a whole lot, and it's an evolution. It never stops, and it's constant change, just like technology and just like medicine.
That's fantastic. It is such a mountain of a task to be able to accomplish all of these things and to understand first that these are problems in our community that need to be solved, and then to figure out a way to solve them. So I really do commend you and all of the thought that you all have put into these issues to try to find ways that are sustainable to be able to heal our communities and make them stronger.
That is the key of sustainability. And Sabrina, I'll throw in that, for me and I think the most important thing for our listeners is to, get attached to a primary care physician. Everybody can't come to the legislature. Everybody can't come to Baton Rouge. They have jobs. They got families. It's right. They got to travel, and it's not. But your primary care doc is the first stop on the journey. And if we connect our loved ones with a primary care physician, at least we can start tracking and find out what's going on. That primary care doc is probably part of either a group or a hospital that has a lobbyist that works with them. And so, when we get to Baton Rouge, we have bills, and these bills are generated to help the healthcare profession take care of those most in need, right? And so
Right.
if we're not connected with a primary care doc, and grandmother has hypertension, she has diabetes, and she's not taking any medicines, not treated, we cannot plug that into the formula. And then when we talk
So
about funding, go ahead, Doc.
that's a great point,
Yes.
Senator Boudreaux, and it leads to my next question, which is, we on the Pulse, and with HeartSense, we try to break it down so that people who are just average citizens in the community can get an action plan if they have an issue and try to figure out what they need to do. My question to you is, if you're someone in the community who has an issue or has a problem that they would like somebody to work on, would it be appropriate for them to go to one of these community organizations like the Council on Aging or Oplus General Foundation to be able to have an entree into those lobbyists that you talked about that can have an impact in Baton Rouge?
Absolutely. So whether it's Opelousas General, whether it's Our Lady of Lourdes, whether it's Ochsner in Lafayette, look, they all are connected in somehow, some way. So yeah, to our citizens, just people at home who say, my voice is not important. How do I get things done? Yeah, they
Yes.
can do that. My office works with Council on Aging. My office tries to work with all of the healthcare providers, all of the stakeholders. Let me throw in the church. Let me throw in the church,
Yes, sir.
because I know, Doc, you have gone to churches and you have done some screening. So what we want to do is we want to encourage our church communities to request that from Ochsner, request it from Lourdes. Can you all have a health screening once a year, twice a year, where you bring those resources to the church, and it's a health fair, and let's check people's blood pressure, because I know and that there are a number of, while I started this segment of the program off by saying the ideal thing would be for all of us to have a primary healthcare physician. I know it's not realistic. Some of us, we go back a couple of generations and the midwives were there. We didn't even go to the hospital for children. And so now we have to deal with reality. So I throw the church in. And so the question that you ask is, how do we connect with those people? So my office, Council on Aging, let's get the churches involved in it. Let's get other community organizations involved in it. And then we go to Ochsner, we go to Lourdes, we go to Lafayette, Opelousas General, we go to St. Martin, and all of these, and that's how we do it. The population, the majority of population, the underserved population of District 24, that voice has been silent. I was elected to speak in Baton Rouge. We need more team members to join us locally, so that it's just not one and done. It's not a hidden one. It's an ongoing, kind of like, we identify a game plan and we stick to it. And that means we want to continue to develop relationships with healthcare professionals across the spectrum. And 232 Help is another resource within this community. In the Diocese of Lafayette, through St. Joseph Diner and so many others, have a network that we want to team with so that people can get those services, and they can connect, as you said, with those lobbyists who are passing bills. One of the first things that the Governor John Bel Edwards did was to take the Medicare expansion. And we know the impact that that's had in Louisiana to ensure that people have access to health care. We want to get the biggest amount of bang for our buck. And we know the underserved population needs it more than any others, because they don't have the insurance, they don't have the resources, they don't have a primary care. And in a lot of cases, they feel left out and forgotten. And some of them have given up on that, Doc. And so, Sabrina, that's where we are, and it's a full-time job. It's something that Dr. Keller has signed up for, and that's why where he is, I'm gonna be, because we need more. We need more warriors. We need more ambassadors, and we need more resources. One of the projects on the sidebar, one of the projects we're working on is the historical Holy Rosary site, which at one time was a boarding school, a Catholic boarding school off of the Burbridge Highway in Lafayette. We now have about $7 million in that account. We want to not bring back the school, but we want to, because of the historical perspective that was on that campus, one of the things we want to bring an African-American museum, but one of the prior things that we want there is a healthcare facility, because it's right again in the neighborhood, and we're working on that right now. So the Health and Welfare Committee is so important, and it's so important that we keep politics out of it. And the quality of life, access to healthcare is just so important. And what we have come to realize is, in those areas again, and I'm talking about a lot of the people that I represent in St. Landry, Lafayette, and St. Martin Parish, especially the rural areas, don't have that access. The Affordable Care Act provided more people with more opportunities to continue to live and have that access. And so again, that's why we're here, and that's why we want to make sure that you don't have to come to Baton Rouge, but how do we make sure that our loved ones are afforded that opportunity to have the best health care that's available?
Yeah, and I want to commend you and the legislature and the governor for allowing Louisianans to have access to Medicaid
expansion
funds. Expansion funds, yes, thank you. That a lot of neighboring states don't have. We have resources to be able to help people with, mental health, and there's so much overlap between public safety and healthcare and wellness because of the restructuring of police departments to take the social health aspects out of the police department, give them people who actually have training in mental health and in recreational health and all these other things for people in the community. That it's really important for us to just take a moment and be thankful for all of the resources that you all have allowed us to be able to have in Louisiana, because some of our neighboring states are not as fortunate.
That's right, yes. Dr. Keller. That's a great point. And look, I'd be remiss. April 2nd, 2020, one of my 3 daughters, Brittany, left this life because of breast cancer, a very rare form of breast cancer. And October 13th would have been her 33rd birthday. But we spent October on Breast Care Awareness Month, and here we are. And you just brought up the governor in one of the first things he did was sign an executive order to allow Louisiana to receive those federal funds through the expansion of Medicaid. And as a result of that, so many people now have their lives have been spared because they were able to go in under their insurance program and take mammograms. They were able to get checks. They were able to start to get treatment. So that's what this is all about. And as I said, I'd be remiss if I didn't take just a personal minute just to identify we've lost a bunch, but we've saved a bunch. So we have to continue with that. And I also applaud Governor John Bel Edwards. It was not a popular thing, and a lot of other states did not do that. And just as a sidebar, when we were able to receive those additional dollars from the Medicaid expansion, what it allowed us to do is take those general fund dollars that we were using for healthcare and put them into other areas like our education system, starting off with pre-K programs and things like that. So that's what our government is supposed to be about, and not about Democrats and Republicans, whites or black, or all those other things. And again, another great point of having this program so that we can cut through some of that. And let's talk about how do we find out what's the pulse of the community. Let's get that sense of what's needed. And I'm just so glad and so proud to be a part of your movement and your team's movement throughout this community.
As my 20-something-year-old daughter would say, fact.
Yes.
Delivering fact.
Yes.
Okay. So, and people don't realize all of these things, but it's important for us to get the word out and let them know that these are things that impact them on a daily basis.
Yes, they
And
do.
they may be going on behind the scenes, and they may not be top of mind all the time, but they're very important for us. And we appreciate you letting us know about all the great things that you guys are doing.
Yes, Senator,
Sabrina?
it's truly inspiring what you are telling us, the community, and then also for people like me who aren't in the state of Louisiana, but are able to hear that impact of how you're really touching the people in your communities. It's so important. And it makes me even think about how can an individual even try to make that difference. So we had a discussion previously before this one where you enlightened us about the mental health for younger children. And I'm wondering if you could just speak to that, because I think mental health is so important now, especially since we've gone through the pandemic and we're still, getting through it. How the state is moving towards that direction of helping with mental health.
Yeah, again, unfortunately, in previous administrations, mental health was put in the closet. We closed our mental health facilities, and we said we were going to privatize them and do this. That didn't work. We talked about our veterans who just alone, when we talk about mental health needed, we just had a conversation about obesity with youth. And now we want to talk a little bit about mental health, especially with our youth. I will share with you on last week in Lafayette Parish alone, there were 10 school closures. I say closures, shut down, because of threats by students at the school, school violence and threats. And so one of the things that's been identified is the fact that a lot of these kids have some type of mental disorder that's allowing them to fall into this, realizing again that school threats and school violence is not a joke, and it's something that's very serious. So in a conversation I had with the superintendent of schools, Dr. Kate Brumley, about 10 days ago, he's committed over the next 3 years to fund up to $60 million in our public schools in the state of Louisiana. Wow. To put school counselors to work directly with our students and identify, number one, the mental health issues, prepare an action plan, and follow through with this so that we don't just say they, check the box, they're okay now, and then we find out later that they really weren't. So that's the commitment coming from the State Department of Education when we talk about how we're going to address mental health, especially with our youth. And it's one of those things that they're not going to come forward. We're going to have to identify it, and at the school, it's going to take all of the school resources working together to say that some of these young people, they've been in traumatic situations. They're in they see domestic violence at home. They come from single parent families who are under a lot of stress. So all of those things factor into where we go as a community and how we develop our young people into adults so that their quality of life could be just a little better than maybe their parents and grandparents. So that's a big one when we talk about mental health. The physical part we see, the mental part is hidden, and it's
stigmatized too sometimes.
Wow.
Yeah,
absolutely. Yes, sir. Yes.
So I got a question for you, Senator Boudreaux, and I'm gonna put you on the spot just a little bit here. But of all the bills that the legislature considered in this past round, which one do you think that passed will have the biggest impact on our community? Which one do you think was, in your opinion, the one that's going to be able to have the most immediate and the most long-lasting effect on our community?
So which bill? So
I know they're all like your children, like you love them all, but I want to know.
You're making him choose a favorite.
Yes,
I
indeed.
am.
Yes, indeed. Look, that's a tough one, Doc. I sign off on a lot of bills and co-author a lot of bills. The ones, and I'll categorize it and give you the political answer. But the process entails lobbyists being involved in delivering of bills to the legislature. And those bills that give me the most comfort is those that have the connectivity, they have the inclusiveness aspect to it, and they pretty much are like grassroots. So, you know, when, like we said, we don't like surprises. When there's a bill that comes before us that kind of has run its course, and while there might be some opposition to it, the local government's for it, you know, the regional people are for it, and everybody's there. It sends a clear message that this one has gone through the process, and it's something that everybody feels is good. The ones that give me the most heartburn is those that come up at the last minute, and there's not a lot of discussion on them. I want to continue, you know, to see how we empower our young people to do more. And so sitting on finance, probably the biggest bills is those that have increased funding for educational purposes. And, you know, we were able to make it mandatory that you have kindergarten. A lot of people weren't aware that the state of Louisiana, it was optional. Now it's mandatory that you go to kindergarten. You know, and so we feel, you know, that's going to put us in a better position. While some parents have homeschooled and done a great job of it, it's just now mandatory that we do it. So a long answer to if we start with that concept of we're gonna put more dollars into kindergarten and let those dollars follow these kids all the way up to higher education, I think we'll be a better state, we'll be a more informed state, and we'll have people, young people, who want to stay here because they have seen what the state has done as far as a commitment for their future.
That's a fantastic answer. And it actually answered my next question, which was, where do you see the future of the legislature and what the themes you are going to be focused on going forward? So I really appreciate such a complete answer. And that was exactly what I was looking for.
Yes, thank you, Senator. The term that I really love that you've been using throughout our conversation today is connectivity. Yes. And how you are really connecting, you're touching those hearts of those community members, and that as a team, you know, that all of these representatives are actually there for their community members, addressing those determinants of care, addressing that education issue, and really creating a social response to the health and well-being of your constituents.
Keeping a healthy network too. I think that's eminently important to being connected to people.
Most definitely. And that was one of the things that inspired me to run for the state Senate, is that on a very critical level, I didn't feel that the district was connected. And I thought, when I look at today, the people that we represent in those three parishes, I've talked about St. Landry Parish, St. Martin Parish, and Lafayette Parish. They are portions of the parish. And the portions of the parish that I represent is no secret that there are a high number of African Americans, there are a high number of people with poverty, and a high number of people who are unemployed and have very little education. I don't run away from it, I embrace it. But when we have three different parishes, and those same people in all three parishes, they were, from my viewpoint, they were battling each other. And no one would ever get enough to make a difference in their communities. And so the connectivity issue was something that I ran on, and I said, we were going to connect those. And now we have similarities. We have people working on the same goals in all three. And there's, the old saying, there's strength in numbers. Now we have three parishes working on poverty, three parishes working on unemployment. And when one wins, the other two win also. So it's not a thing about us and them, it's we. We will get there together. So the connectivity issue is the same when we talk about mental health, when we talk about obesity, when we talk about chronic heart disease, things that people never talk about because they either don't know enough about it or they're afraid to embrace it.
Yeah.
And again, Doc, that's what you and your team have been able to do, is to get out in the community and go meet these people and say, you identify what it's going to take, and they ask the questions as to how do we make this conversion.
That's absolutely right. And it has been very gratifying for us, especially because we get to meet people and find out what's on their minds and try to help some of them get redirected towards care that they need, but they might be afraid to go and seek out. And so I want you to, one of the things that I think is most remarkable about what you have been able to do is every time we go out and do these community heart screenings with this technology that we've been granted by some very fine companies in California, one of them being Echo Health. We go and we listen to people's hearts and try to find murmurs and then direct them to places where they need to go. Every single time we have been out in the community, in your district, your face come to my screening program. And I really appreciate that more than you will ever know, because we know that your time is very valuable, and we know that you have a lot of things on your plate, but we appreciate you for everything that you do. It's interesting because I was telling Sabrina, we actually went to the legislature to demonstrate what a typical screening program would look like, because we want all the representatives and senators and the governor and the mayors to be able to take advantage of our technology, because it is remarkable, and it does make an impact on people to actually see exactly what's going on, to give them the confidence to go to the doctor, or the confidence to say, well, maybe I can wait a little while.
Yeah.
Yes. And I guess that brings me to kind of a fun question. Senator Boudreaux, have you had your heart screened at one of our screening events?
Well, I was a part of the meeting where Dr. Keller and his associates came and presented a model of how it would look if he came to our communities with the legislature. And so, of course, I was one of the first. So when you talk about yourself, it's okay to say one of the first guinea pigs. But I was one of the first ones in to go get tested. And this equipment, which is just, as Dr. Keller said, they're the beneficiaries of, state of the art, top of the line, the best of the best, the newest of the newest, that could tell you just everything about your heart with just a few minutes. I sat in the chair, and Doc had two of his associates with him, and he told the group that it would be within 30 seconds he could tell us what problems or what issues you have, and then they would if we were in a screening setting, of course it would be some privacy there, and then if you had problems, they would say, well, we probably need to refer you to this person. You probably do this and that. So I sat in the chair, and Dr. Keller used the equipment the way he always does, in a timely and a professional manner. And I recall the 30 seconds that he had talked about, knowing if there would be problems, the machine would let him know. And about the 2-minute mark, I'm looking at him. And of course, I pretty much was holding my breath, because I was like, something's not right. And
2 minutes. Oh,
yes. So which felt like 20 minutes, right? And so he looked at his associates and he couldn't hold it anymore. And then he broke down, and he gave me a smile, and he said, blood pressure is 120/80, no heart murmurs. We hear no negative signs of any obstruction. Everything is good, Senator, and we thank you for this. And I started breathing again. But it was a great opportunity to see how the equipment works. And also to understand the process that had it been a need, I would have at that point been referred to get some immediate help, and not be sitting in the stands at an athletic event or something and have to dial 911 to come get me, which sometimes is just a little too late.
Yeah.
Right. Exactly. That's so funny. Wow, Dr. Keller, you made him sweat for 2 minutes.
That's
you
a
didn't
good
tell him.
Story.
Oh.
We need to make a poster of
make a poster of it.
You can be the poster child. Yes. That's a great
poster
story.
child of our first heart screening with
legislators. And Sabrina, we're trying to give them all the information. And one of my objectives, of course, and we've had some great dialogue, The Louisiana Secretary of the Department of Health and Hospitals is Dr. Courtney Phillips. And we've had the opportunity, Dr. Keller and I, to meet with her. And we're now in the process of seeing how can we develop a partnership? How can the Louisiana Department of Health add some resources to the plan that Dr. Keller and his associates have laid out to make sure that we reach those most in need, especially in those areas that we talk about that have not been accessible. And I'm very confident that we're going to come to some type of conclusion that we'll be able to do so much more with the assistance and the partnership of the Louisiana Department of Health and Hospitals. And we thank Dr. Phillips for that.
Wow.
Absolutely. We are very grateful.
Yes.
Dr. Phillips has quite the vision for improving the healthcare for the populace in Louisiana, which is a significant proportion of them live in rural areas and areas that don't have access to up-to-date medical technology. So I commend her for her vision and her outlook, and I look forward to working with her to try to see whatever we can do to help her with that mission.
Thank you.
Wow,
Thank you.
that is just amazing that Dr. Keller, you and your team with HeartSense kind of started this mission a few years ago to just touch the hearts of your own community members. And now you're at the point that you might be able to do something for your whole state. And then maybe someday go beyond that to the nation.
Without a doubt, I see that. I see us as having, and Dr. Phillips and I've had that conversation where if we get this footprint together, this could be the model that the entire country does. You know, we spend so much money on healthcare and our outcomes just don't show it. You know, we see so many people who are so sick. And so we gotta kind of hit the reset button. And I'm just so pleased to be an associate of Dr. Keller and his team, because I see that we can move the needle and we can change the lives of so many people if we all get on board and pull in the same direction.
Yes.
Absolutely.
And just going back, it's that connectivity and the we, not the individuals. So
that's right. It's not I, it's me. Yes.
Yes. Well, thank you so much, Senator Boudreaux, for your time today. And Dr. Keller, would you like to finish anything off for this episode of The Pulse?
Yeah, absolutely. I want to thank Senator Boudreaux again, and to let him give a little plug for some events that he has coming up in Opelousas on the 29th of October. There's a community health fair that HeartSense is going to certainly contribute and be a part of. A pharmacist there named Danya Willis, who's very interested in community health, and a very well-traveled young lady that's very smart and very high energy, is going to be holding an event there. And also we have the First Harvest Community Garden, which HeartSense is going to donate some garden equipment to, so that they can reduce food insecurity in the area and allow them to be able to grow things in the community that they can share with the community. And it's two very, very nice projects that we are very proud to be associated with in a couple of weeks.
So everyone out there that's watching, October 29th is when that heart screening for HeartSense will be part of that fair. And we will provide more information on our website and on our social media channels, as well as any other information for upcoming screenings.
Thank you, Sabrina.
Thank you.